The Theology, Medicine, and Culture Initiative at Duke Divinity School has been hosting a series of conversations about COVID-19 with faculty and alumni. In this clip, TMC Associate Director Brett McCarty talks with Matt Frederick and Martha Carlough. Dr. Frederick is an emergency room physician in Seattle and a TMC alum, and Dr. Carlough is a family medicine physician at UNC Chapel Hill and directs spiritual formation for TMC fellows.
It was from, I think, the second day that I had worked when this was happening. And up until that point, most of the patients that I had seen with probable COVID, I think I had admitted one or two, but none of them were like critically ill. So I was working that second morning and I got a phone call from the medic that said, hey, listen, we're on our way with a respiratory distress, 85-year-old guy from Life Care Center. And it's like, wow, okay. I mean, we had talked a lot about how managing an airway in these patients, doing intubation or BiPAP was particularly high risk. And that seemed to be the way that a lot of people in Wuhan had been infected. So I don't think anybody was really excited about the prospects of needing to emergently intubate this guy, which is what was going to happen. Our medics had stopped intubating people by that point because when they intubated people, it took the rig out for 3 hours. So they were just transporting them in, half dead, essentially. And they had to be intubated in the first 5 or 10 minutes when they got there. So this guy came in, and once he came into the room and the nurses were in the room, we wouldn't leave essentially until our job was completely done. So we couldn't go back and forth in and out. We were all in PAPRs. And so I was in the room for probably about an hour, all told, between getting the guy intubated and putting him on the vent and putting a line in and kind of making sure that we had everything figured out. And eventually I got to the point where I could kind of step out and make some phone calls and get the guy dispositioned to an ICU bed. And when I went out, about 5 or 10 minutes after I'd been out of the room, I realized I kind of hadn't thought about him as a human being for a single second of that 1 hour. And normally, during a resuscitation, there's definitely an objectification of a person, but that's sort of inherent in what you're doing. But to not have thought about that even one time is pretty unusual, I think. And it was just the stress and the anxiety of wearing all this plastic, and you've got a vented helmet that's the fans rattling in the back of your head and you can barely hear anything, and you're kind of watching what everybody's doing. And so it was a little bit sobering to realize that I hadn't thought about him as a person once. Once that kind of set in, I realized hey, I need to go grab his family. Went and grabbed his wife, and 2 daughters were there. Could only have one visitor back at a time. So I brought his wife back, and this was like second day. Nobody had done this yet in our hospital. We didn't know how it was supposed to work. And I realized about halfway as I got back to the room, well, she can't go in the room. Nobody can go in that room. We don't have a PAPR that she can wear. And after kind of talking with some of our nurses, and they were all in agreement, yeah, there's no way that we can let her in the room. So, I had to watch her essentially say goodbye to her husband as he lay there ventilated, 15 feet away in an isolation room. And that was the closest that she would ever be to him again, because once he got to the ICU, our entire ICU was closed to COVID patients. So you couldn't even walk in the doors of the intensive care unit. And that was hard. I mean, I'll never forget that for the rest of my life, watching her sob against the glass pane window, and all of us being completely confused and helpless about what this was and what we were supposed to be doing.
I would first say it's been really important to build relationships with colleagues, and I really have seen some people going way, way out of their way. But I wanted to share a psalm if I can, which it's Psalm 121. No surprise that this is one of the Psalms of Ascent. And I will just read it quickly if that's okay. So I lift up my eyes to the hills. From where does my help come from? My help comes from the Lord who made heaven and earth. He will not let your foot be moved. He who keeps you will not slumber. Behold, he who keeps Israel will neither slumber nor sleep. The Lord is your keeper. The Lord is your shade at your right hand. The sun shall not smite you by day, nor the moon by night. The Lord will keep you from all evil. He will keep your life. The Lord will keep your going out and your coming in from this time forth and forevermore. And it's just a really beautiful psalm for this season. I started reading it because of the last verse, the going out and coming in, as I was doing home testing more, and prayed that, trusting that I was doing my best in those situations. But it also obviously represents this sense of going up a mountain that we can't quite see the top of. But God is not slumbering. God knows all about this mountain, and he is our keeper, which is repeated 6 times in this short psalm. And so I think that that is really important to know that God is not sleeping. He hasn't left us alone. And no matter what we're doing, he is in the midst of this.
Martha, what advice would you give to other clinicians and trainees as they think about how to approach practicing well and faithfully in the midst of COVID-19?
Yeah, well, the current fellows on our spiritual formation session this morning talked about a rule of life, which, as we all probably know, is like a trellis or a framework that we can build spiritual habits on. And I think in this season, we really need to pace ourselves, and the rule doesn't apply to a whole year, but maybe just day by day. And so intentionally practicing things like digital fasting. I've made personal rules about not picking up my iPhone before I pray and read scripture in the morning, and having a couple hours in the afternoon, and then not looking at the computer after 8 o'clock at night. What I mentioned before in terms of generosity and kindness, and leaning into it even when it feels hard. I think sort of habits like that, just getting outside, and really trying to pace ourselves. We are only human beings, and we have limits. And I think when we don't pay attention to those things, we end up not being able to serve and live in healthy ways. So that would be my advice. We're behind Matt. I have probably yet to know my busiest clinical season of this yet. I'm sure that's true for Warren and Farr as well, and does feel a little intimidating. And so I'll be glad to be on the other side of it for North Carolina, but trying to put things in place that make me feel like I have some normality to a really different schedule for now.